Republican Senator John Thune joins us now live from Washington. Thanks for being with us, Senator. This was not, I want to make clear to our viewers, this was not a vote to pass health care. This was a vote to begin debate on a bill. You voted against the commencement of debate. What's wrong with an open and honest debate?
Well, it's a partisan debate, Greg. It has been from the beginning. Republicans haven't been included in any aspect of this. They wrote this bill behind closed doors. We just saw it a couple of days ago. And we think it represents a massive expansion of the federal government. It includes a government plan which could lead to the government takeover of health care in this country. It's got huge tax increases, huge Medicare cuts. And we believe that a vote to get on this bill is essentially saying the substance of the bill is something that you support. And we don't expect through the amendment process the contours of this bill to change a lot. And so tonight was an important vote. It wasn't unexpected that it would be a partisan vote after the way that this process has played out from the beginning. But we also think there's some game to play yet, and we're going to be offering amendments when it comes to the floor. And we think the next vote's going to be a lot harder one for a lot of these Democrats who basically walked the plank and voted for this tonight.
We just got a statement from the White House. Let me read it off my computer, if you'll hang with me for a moment. The president is gratified that the Senate has acted to begin consideration of health care insurance reform. Tonight's historic vote brings us one step closer to ending insurance company abuses, reining in spiraling health care costs, providing stability and security to those with health insurance, and extending quality health coverage to those who lack it. The president looks forward to a thorough and productive debate. Senator, even if it's true that this bill raises taxes and raises overall costs, is it, playing off the president's remarks here, is it worth it to help extend health coverage to some 30 million Americans who don't have it?
Well, I think the thing that you have to look at is what are the goals of health care reform? Obviously, to provide access to those who don't have it. There are ways of doing that short of a $2.5 trillion expansion of new spending. Obviously, as I said before, the Medicare cuts, the tax increases that are included to pay for this bill. But the problem you have, Greg, is the other goal of health care reform is to get costs under control. This bill does nothing to do that. It's a $160 billion increase in health care spending, according to the Congressional Budget Office. Premiums are going to go up for most people in this country. There are going to be a handful of people, about 19 million people, who will be able to get health insurance through these exchanges. The other 182 million people who currently have health insurance in this country are going to see, one, their taxes go up, and two, their premiums go up. So if you have health insurance in America today and you're trying to get the cost of that health insurance down, this does nothing to do that. And in fact, it does the opposite. It's going to increase the cost of health care for most people in this country. Yeah. So we don't believe that the overall purpose of health care reform is served with this legislation. In fact, we think it's the opposite. Health care costs are going to go up, not down. Taxes are going to go up, not down. Spending is going to go up dramatically. And we're going to have a whole new entitlement in Washington, D.C. that we're already building upon a foundation that is crumbling and faltering, and that's a Medicare program that's destined to be bankrupt in the year 2017.
Are there some good parts of this bill? I mean, after all, Senator, this bill would stop insurance companies from dropping people who get sick. As I understand it, would deny coverage for, it would stop denying coverage for pre-existing conditions. You're in favor of those provisions, aren't you?
Well, there are things. Remember, this is a 2,100-page bill. This is a huge piece of legislation. So, of course, there are provisions in there that are good, and there are things that all of us support, along and two of which you just mentioned. And I think there are other things that we can do that we could find some common ground on if we were willing to sit down in a bipartisan way and work in a step-by-step way to find solutions to health care. We believe that buying insurance across state lines, for example, allowing small businesses to pool, to buy in larger groups. We believe in lawsuit abuse reform. There are so many things that can be done along with what you just mentioned in terms of pre-existing conditions and portability that everybody agrees upon. And our point is, why can't we do that? Why can't we make this a bipartisan exercise that builds step by step and on the existing healthcare system that we have today, rather than destroying it entirely, allowing the government to take it over and creating a $2.5 trillion expenditure for the American taxpayer?
One of the ways that the White House and Harry Reid say it is in the end deficit neutral is the raising of taxes. Is raising the payroll tax and indeed other taxes to pay for this in the middle of a recession with 10% unemployment, a profoundly bad idea in your judgment?
It is, and here's why. The best way for people to get insurance today in this country, as long as we continue to have an employer-based healthcare system, is to get a job. And we've got a lot of people without jobs in this country. We ought to be focused on creating jobs, growing the economy, and providing incentives for small businesses to hire more people and offer them health insurance. What we're doing is we're going to tax all these small businesses in this country, and you're also going to see, as you said, a payroll tax increase, which, by the way, doesn't go to extend the life of Medicare or put Medicare on a more sustainable path. It goes to a totally unrelated new entitlement program. There are all kinds of new taxes in this bill, most of which are going to fall on small businesses, which are the economic engine that creates jobs in this economy, and ultimately where most people get their health insurance. Yeah. So all the taxes that are included in this bill, we think are going to be very detrimental to the long-term objective of making health insurance more accessible and more affordable to more Americans.
Senator, I wonder if you think Harry Reid is being straight with the American people, and you touched on it, but I want to dip into it a bit more. Harry Reid, the majority leader, has promised that this bill will reduce health care costs. But the nonpartisan CBO, page 16, we looked it up, says it will increase the federal outlay and the budget by a net of about $160 billion. Again, page 16, it's right there. Is the majority leader, in your judgment, deliberately misrepresenting the truth?
I think what they are doing is they are trying to sell a product because they are so desperate to get an accomplishment that I think they're trying to, there's more of a political motivation behind this than there is, in my view, solving the problem. But I think they are really desperate to be able to pass something, and they've got to convince people across this country that this actually does something to reduce costs. But in fact, as you just noted, the Congressional Budget Office has made it very plain that this does nothing to bend the cost curve down. It actually increases the cost of health care by $160 billion. And with respect to reducing the deficit, there are so many budget gimmicks and scoring tricks that are included in this, like delaying the implementation date, that this thing in the long run, because my assumption is in the end that a lot of the Medicare cuts aren't going to occur, is also going to add a significant amount to the federal debt, which is already growing at over $1 trillion a year. So this thing has major problems. I don't think they can sell this idea that it actually reduces health care costs when you've got the cold, hard fact of the Congressional Budget Office staring you right in the face and saying this increases health care costs in this country.
I guess one of the ways that they achieve the neutrality, fiscal neutrality, is that they don't begin the reforms, as you point out, for about 5 years, yet they start collecting taxes in 2011. As one of your colleagues said, it's a shell game, a sleight of hand. And by the way, we reached out to almost all of your Democratic colleagues, and none of them were willing to go on camera with us. We would have loved to have posed that question to them. Senator John Thune, thank you very much.
We'll be posing that question of them in the weeks ahead, Greg, and I hope the American people do too.
I had a feeling you would. Senator, thanks so much. It's been a long night. Thank you.